So in this session, we'll be dealing with the ventricles of heart. So if we see this is an anterior view. This is the sternocostal surface where you can see this entire area is formed by the right ventricle. So and this small part of the sternocostal surface is formed by the left ventricle. So if you see here, 2/3 of sternocostal surface is formed by the right ventricle and 1/3 is formed by the left ventricle. So this is again the diagrammatic representation of the sternocostal surface. You can see this is the right ventricle and this is the left ventricle. And here you can see this is the diaphragmatic surface where 2/3 of the diaphragmatic surface is formed by the left ventricle and 1/3 of the diaphragmatic surface is formed by the right ventricle. So this is again the diagram showing the diaphragmatic surface where 2/3 is formed by the left ventricle and 1/3 is formed by the right ventricle. So we'll be dealing with the right ventricle. So this is the right atrium. This is the right atrioventricular orifice guarded by the tricuspid valve. So this is the interior of the right ventricle. So this is the rough inflow part and this is the smooth outflow part. You can see clearly the rough part and smooth part both are separated by the supraventricular crust. And you can also see an additional bridge-like structure here from the ventricular septum to the anterior papillary muscle. There is a moderator band or the septomarginal trabeculae. So I'll explain all these terms in detail once we go into the depth of the lecture. So right ventricle, it is located in front and to the left of the right atrium, contributes in formation of following features of the heart like 2/3 of the sternocostal surface as I explained in the earlier pictures and 1/3 of diaphragmatic surface and most of the inferior border. So on cross section, it appears semilunar in shape because ventricular septum bulges with convexity towards right ventricle. So wall is thinner than the left ventricle. Right ventricle wall is approximately 3 to 5 millimeter thick, whereas left ventricle is 8 to 12 millimeter thick. Ratio is almost 1:3. So the right ventricle, as per se, if you see, it has three surfaces. Don't confuse this with the surfaces of the heart. This is only the surfaces of the right ventricle. The first one will be the sternocostal surface. It is separated from the sternum and ribs by three layers of pericardium, forms area of cardiac dullness. Above and lateral to cardiac dullness, it is overlapped by left lung and pleura. Inferior surface separated from central part of the diaphragm by pericardium, and posterior surface. So posterior surface of the right ventricle is nothing but the ventricular septum. Interior of the right ventricle is at two parts: inflow part, also the rough part, which is called ventricular proper, and outflowing part, otherwise the smooth part, called as conus arteriosus or infundibulum. The supraventricular crust intervenes between the inflow and outflow parts. You can see here, this is the inflow part and this is the outflow part. Inflow part is rough, whereas outflow part is smooth, and both are separated by the supraventricular crust. You can see here, this will be the anterior papillary muscle, this will be the posterior papillary or inferior papillary muscle, this will be the septal papillary muscle. These are the chordae tendineae, these are the leaflets or cusps, this will be the tricuspid annulus, and this will be the right atrioventricular orifice. And you can also see this is the septomarginal trabeculae. Septomarginal trabeculae, otherwise called moderator band. So inflow part presents following features like right atrioventricular orifice and tricuspid valve complex. Right atrioventricular orifice is oval or circular in outline, almost vertical, making an angle of 45 degrees with the sagittal plane. Circumference of the right atrioventricular orifice is 10 to 12 centimeters. Then coming to the tricuspid valve complex, it has the tricuspid annulus. Leaflets are cusps of the tricuspid valve, chordae tendineae, and papillary muscles. Tricuspid annulus, it's a collagenous ring. Bases of the cusps are attached to it. Lamina fibrosa of cusps is continuous with the collagenous tissue of the annulus. Annulus is composed of two phyla coronariae, anterior and posterior. So these two are attached to the right fibrous trigone or central fibrous body. Tips of the phyla coronariae are connected by sulcal connective tissue. You can see here. So this is the anterior and this is the posterior phyla coronariae of the tricuspid annulus, and you can see this is the sulcal connective tissue connecting the tips of the two phyla coronariae. And you can also see this is the anterior leaflet, this is the septal leaflet, and this is the posterior leaflet of the tricuspid valve. So leaflets are cusps, three cusps. Anterior is the largest, then posterior, and septal is the smallest. Junction between the leaflets is called as commissure. Three in number: anteroseptal, anteroposterior, and posteroseptal. So each leaflet has a free margin and an attached margin. Free margin of the posterior leaflet presents two clefts which divide the leaflet into three scallops. Each leaflet is formed by reduplication of endocardium containing lamina fibrosa. So each leaflet presents three zones: basal zone, clear zone, and rough zone. So rough zone, the ventricular surface of the rough zone gives attachment to chordate antennae. Atrial surface of the rough zone closes the atrioventricular orifice during ventricular systole by approximating with the other cusps. Clear zone is devoid of chordate antennae. Basal zone, basal cardia are attached to the ventricular surface. So if you see here, this is the anterior leaflet, this is the septal leaflet, this is the posterior leaflet. You can see here between these leaflets, these are called as commissures. The junctions are called as commissures. And if you observe properly, each leaflet is having three zones. This is the rough zone, this is the free margin, and this is the rough zone, and then clear zone, and this is the basal zone. And here you can clearly observe that this chordae tendinae which are attached to the commissures are called as commissural chordae, and which are attached to the clefts, these are called as cleft chordae. So posterior leaflet is divided by two clefts into three scallops, 1, 2, 3, and here these are the cleft chordae and these are the commissural chordae, and you can see these are the free chordae which are attached to the free margin, and you can also see this is a rough zone chordae. This is a rough zone chordae which will divide into three strands. One will attach to the free margin, one will attach to the midway between the clear zone and the free margin, the other one will go to the junction between rough zone and the clear zone. And you can see this is the basal chordae going to the basal zone of the leaflet, and you can also see here deep chordae which directly goes to the junction between rough zone and the clear zone. We'll classify this chordate antennae next. I'm explaining here so that it will be easy for us. So chordate antennae, these are endothelial covered collagenous threads, two types: false, which are irregular and connects ventricular walls; true, which are regular and connects apical one-third of the papillary muscles to the cuspal leaflets. So these help in valve closure during ventricular systole. Six types, as I was explaining in the diagram: commissural, which are fan shaped and attached to commissures; cleft, again which are fan shaped attached to clefts and scallops; free marginal, which are attached to the free margin of the cusp or leaflet; basal zone, basal chordae attached to the basal zone; deep chordae directly attached to junction of rough and clear zones; rough zone chordae, they have three strands, one attached to the free margin, one attached to the junction between clear and rough zones, and one attached to the midway between them. Trabecular carneae, the rough impressions within the walls of the ventricle of the inflow tract is called as trabecular carneae. So they are present in three types like ridge, bridge, and pillar. So ridge in the right ventricle is the supraventricular crust, so which is a derivative of bulboventricular ridge. It is located in the posterior wall of the infundibulum. So extends from ventricular septum to the right atrioventricular opening. So this separates the inflow and outflow tracts. Bridge, septomarginal trabeculae, also called as moderator band, connects right side of the ventricular septal wall to the base of the anterior papillary muscles. I have shown in the earlier diagrams. Contains right branch of the atrioventricular bundle, prevents over distinction of the right ventricle. I can show you here. See here, this is the supraventricular crust, which is an example for ridge, and this is the septomarginal trabeculae, which is an example for bridge. It is bridging the septum to the papillary muscle. And these papillary muscles are examples for the pillars: ridge, bridge, and pillars. So pillars of the papillary muscles, these are conical muscular projections. So anterior papillary muscle attached to sternocostal surface, posterior papillary muscle to the inferior surface, and septal papillary muscle, if present, attached to the ventricular septum. So apical one-third gives attachment to the chorda tendineae. So outflow tract, also called as conus arteriosus or infundibulum. It is conical, smooth walled and truncated. Apex presents pulmonary orifice which is guarded by three semilunar cusps, two in front and one behind. Each cusp presents a nodule and two lunulae on each side of the nodule. So above each cusp lies the pulmonary sinus, which is filled with regurgitant blood during diastole and helps in closure of the pulmonary orifice. Pulmonary orifice looks like triradiate lines during diastole and triangular during systole. Lower limit of the infundibulum is marked by supraventricular crust in dorsal wall and septomarginal trabeculae in the ventral wall. Roughness of inflow part reduces the velocity of blood, whereas at the same time, smooth outflow part increases velocity of the blood during ejection phase of the systole. So left ventricle, again this is the left atrial chamber, this is the mitral valve complex with the left atrioventricular orifice. So these are the anterior and posterior leaflets or curves, cardiac antennae, two papillary muscles, anterior and posterior, and see the thickness of the left ventricular wall. Left ventricular wall is almost 3 times thicker than the right ventricle. So this is again the same thing. So left ventricle conical in shape, circular in cross section, thicker than right ventricle, almost 8 to 12 millimeter. Contributes in formation of following features of heart, like 1/3 of the sternocostal surface, 2/3 of the diaphragmatic surface, and most of the left surface. In the apex, muscle wall is thin, and in aortic vestibule, muscle replaced by the fibrous tissue. Aortic vestibule is nothing but the smooth outflow part of the left ventricle. You can see the proportionate thickness. See the thickness of the right ventricle and see the thickness of the left ventricle, and see the cut section. On cross section, the right ventricle appears semilunar, whereas the left ventricle appears circular because the interventricular septum bulges with convexity towards the right side. Two parts: inflow part, rough part, otherwise called ventricle proper, and outflow part, smooth part, also called as aortic vestibule. So separating these two, in the right ventricle it was the supraventricular crust, in the left ventricle it is the subaortic curtain and anterior leaflet of the mitral valve, which intervenes between the inflow and outflow parts. So inflow tract having the left atrioventricular orifice and mitral valve complex. Left atrioventricular orifice smaller than right atrioventricular orifice, 7 to 9 centimeters is the circumference, and left atrioventricular orifice is situated posterior superior to the right atrioventricular orifice. Mitral valve complex is having the mitral annulus, leaflets are curves of the mitral valve, and then cardiac antennae and papillary muscle. So mitral annulus is a collagenous ring consisting of the following. The following are present within the mitral annulus, namely the left fibrous trigone, right fibrous trigone, central fibrous body, anterior and posterior phyla coronaria. Both phyla coronaria are connected by sulcal connective tissue. I'll show you this in the diagram. See here, this is the right fibrous trigone, this is the left fibrous trigone. This is the anterior and posterior phyla coronariae. So this is the anterior leaflet and this is the posterior leaflet. And you can also see this is the subaortic span, which is continuous with the anterior leaflet. These two together separate the inflow and outflow tract of the left ventricle. You can also see here this is the tendon of infundibulum connecting the pulmonary orifice with the aortic orifice. Leaflet circles, anterior leaflet attached to anteromedial margin of the annulus. So at base, this leaflet measures around 3.5 centimeters. Posterior leaflet attached to posterolateral margin of the annulus. At base, it measures around 5 centimeters. So separated by the posteromedial and anterolateral commissures. These two leaflets are separated by posteromedial and anterolateral commissures. These commissures are nothing but the junctions between these leaflets. So basal zone is absent in the anterior leaflet. Ventricular surface of the clear zone of anterior leaflet and subaortic curtain together form the posterior wall of the aortic vestibule. So this aortic vestibule is the smooth outflow part. Ventricular surface of the clear zone of anterior leaflet along with the subaortic curtain together form the posterior wall of the aortic vestibule. Posterior leaflet divides into 3 scallops by 2 clefts. So each scallop has rough, clear and basal zones. Posterior leaflet rough zone has greater surface area, so performs greater role in closure of mitral orifice than anterior leaflet. You can see here this is the anterior leaflet where basal zone is absent, and here this is the posterior leaflet divided into 1, 2, 3 scallops by the 2 clefts, and each scallop is having a rough zone, clear zone and a basal zone. And these are the cardiac antennae like I have explained in the right ventricle, and these are the two papillary muscles, and most important thing is this stert cardi, so which are the strong cardi extending between the anterior leaflet and the papillary muscles. Cardiac antennae, these are similar to that of the right ventricle, but anterior leaflet has two peculiar strong strands of rough zone cardi known as stert cardi, which provide better anchorage during systole. So trabecular cornea, as in right ventricle, here there are not much prominent ridges and bridges, but we have papillary muscles, two in number, anterior sternocostal and posterior diaphragmatic. But these trabecular cornea are more numerous and prominent than in right ventricle. So outflow tract, it is smooth walled, truncated and conical. Ventricular surface of the clear zone of anterior leaflet and subaortic curtain. Please remember this, ventricular surface of the clear zone of the anterior leaflet and subaortic curtain together form posterior wall of the aortic vestibule. So this aortic vestibule is mostly fibrous, muscle tissue is scanty. Summit of the vestibule has aortic annulus, which is guarded by three semilunar cusps. Each cusp presents a nodule and a two lunulae on each side of the nodule. So above each cusp lies the aortic sinus of Valsalva. So there are three in number, one anterior and two posterior. So there will be a supravalvular ridge, which is a circular ridge above the free margin of the aortic cusp, represents the upper limit of aortic sinuses. So these aortic sinuses of Valsalva are classified as coronary sinuses and non-coronary sinus. The coronary sinuses are anterior aortic sinus, which gives rise to right coronary artery, and left posterior aortic sinus, which gives rise to left coronary artery. And non-coronary sinus is the right posterior aortic sinus. So this right posterior aortic sinus bulges into the right side of the interatrial septum as torus aorticus. So you can see here, these are the three aortic cusps, and this is the aortic sinus of Valsalva. You can see here, this is the right coronary artery arising from the anterior aortic sinus, and this is the left coronary arising from the uh, left posterior aortic sinus, and this is the non-coronary sinus, that is the right posterior aortic sinus. So ventricular septum presents convexity towards right, I have shown in the earlier diagram. External surface attachment is represented by the anterior and posterior interventricular grooves. Two parts are there: membranous part, which is the small oval posterior superior part of the septum; muscular part, which is the major part, which is the anterior inferior part of the septum. So base of the septal leaflet of the tricuspid valve extends from muscular part of the septum to the central region of the right side of membranous part of the septum with an angular bend. So this connection is important because as a result, the part of the septum in front of septal leaflet is interventricular, separating the two ventricles, whereas the part of the septum behind the septal leaflet separates aortic vestibule from the right atrium, hence called atrioventricular septum. I'll show you in the diagram. So tracings behind it continues with the interatrial septum through right fibrous trigone, and above it continues with the tendon of infundibulum, which I have shown in the diagram. So defects, ventricular septal defect may be present alone, or it might be in a combination of multiple defects like tetralogy of Fallot, where you can see the pulmonary stenosis, overriding of aorta, ventricular septal defect, and right ventricular hypertrophy, or the rarest of the rarest, called trilocular. So biatrial monoventricular heart due to absence of interventricular septum. You can see here, this is the membranous part of the septum, and you can see this is a septal leaflet, as you see here. So in front of this septal leaflet, you can see this part is actually separating the two ventricles, this entire part. So that's why this is the interventricular part. Whereas if you see this part of the interventricular septum, it is actually separating this right atrium from the ventricle, aortic vestibule of the left ventricle. So this part becomes the atrioventricular part of the septum. You can see here, this is the interventricular septum. So this is the cut section of the right ventricle, which is semilunar, and this is the cut section of the left ventricle, which is circular. And you can see these are the valves. So this is the tricuspid valve, this is the mitral valve, this is the aortic valve, and this is the pulmonary valve. These are the semilunar valves. So thank you. So art of medicine lies in the heart of a doctor.